Hey, Amanda, thanks so much for joining us today. Folks that don't know, prior to COVID-19, what was Healthy Learners doing in communities across the state?
Healthy Learners' mission is to remove children's health barriers to learning. And so these health barriers can look like vision problems, dental problems, hearing, mental or behavioral issues, persistent hunger. So all of these things we know prevent them from thriving in the classroom. Healthy Learners works very closely with school districts across the state to coordinate those efforts and make sure those kids really act as that bridge between children and healthcare. So for many parents, it's just really hard to take off work to get kids to an appointment. That might mean losing that income and that difference between working or not working for that day. And so our staff actually goes to the school, picks up the child, takes them to their doctor's appointment, and then brings them back to school.
But explain to folks that don't know kind of how your service has shifted.
Our traditional service is serving kids in school, right? And kids are no longer in school right now. And so we had to pivot pretty quickly and figure out what needs we can meet. And really our mission at its heart, and kind of what we keep saying, is that love is in our mission, because our mission statement is removing those barriers of love and compassion, right? And that's kind of falls underneath of just our guiding principles. We're working with many statewide coalitions that, we work to connect through you and through other partners to just see what the needs in those communities are, whether that's kids, seniors, adults. And so we are delivering food. We know that access is a huge issue right now, because even if resources are available, like the school meals and the pickup lines and things at certain schools, that doesn't mean that people can get to those lines. We know that there are many people that do not have a motor vehicle, or if they have one, they can't afford the gas right now to get there, or it's being offered in a time frame where they have to work, or whatever the circumstance may be. And so we're working with Richland One, for example, and we have been delivering meals out to those homes and zip codes, and we've delivered over 6,000 meals already in the last couple of weeks with our staff. We've got, again, staff and a fleet of vehicles around the state, so we really feel like we have an opportunity to break down kind of that transportation and really that access barrier right now. We're also working with many councils on aging to serve some of the senior populations. What's happening in Orangeburg and Allendale County. Our team in Georgetown is taking food in partnership with the Salvation Army to homebound seniors. We're working to get prescriptions to both students, adults, and seniors that might not be able to pick up those prescriptions. 1 in 5 kids
in South Carolina are going hungry at some point.
That 1 in 5 number was before COVID-19. You know what I mean? Like, that was under the best of conditions. And so I keep seeing some of those, and we've looked up those statistics for some of our specific communities, and then you just have to wonder, like, what is that number right now, because we don't know. One thing that we worked with you guys on, I guess kind of speaking of different demographics, was figuring out how we can serve the Hispanic population, just because the resources are there. If they're not being communicated in Spanish or getting out through the modes of communication. We kind of noticed that on our first food delivery, where we didn't deliver to one Hispanic family, and we're in the Midlands, and we know that isn't right, so how can we make sure that they know about the school pickup sites and the meal delivery and things like that. And so we're just trying to make sure that some of those gaps are really addressed as well.
We've worked with Healthy Learners in Paso to translate our local activities going on throughout the state. So you can visit eatsmartmovemore.sc.org. Yeah. Well, Amanda, thank you. Thank you to Healthy Learners. We really appreciate your willingness to be a part of this interview, but more importantly, all of the work that you're doing.